Well, it is said that child mortality remains one of the great shames of our modern world. You can't believe that these things are still happening even today with all the education, all the globalization that we hear of. But we're talking health issues of children under the age of 5 with World Vision here on my banner. And my guest this morning joining me, Raymond Owusu, is a health and nutrition specialist, and Michael Ayo-Olad is child health coordinator at World Vision. All right, good morning, guys. Thank you.
Good morning. Good morning.
So these statistics that I'll share in, you've got something to explain to us.
Yes, thank you very much. I was saying that when it comes to maternal, newborn, and child health issues in Ghana, currently according to the MIX, that is multiple indicator cluster survey, we have 82 children dying per 1,000 live births, and then we also have 53 children dying per 1,000 live births when it comes to child mortality and infant mortality. But you did get it right also when you talked about 350 mothers dying out of 100,000 births, and that is so alarming, and we are here to share with you some of these issues and how we can all come on board.
So let me just ask Raymond, what is going wrong? I mean, there's a lot of education.
Yeah, thank you for the opportunity. Yes, there's a lot of education, but then more needs to be done. And when it comes to health, it's not only the government, but then other partners, including us, have to do a lot more. When you take what has been happening over the years, Ghana has made progress in terms of bringing these levels down. But then when you look at it, we have a great number of our citizens who live, especially in the rural and very remote areas, who still have challenges. Let me just say that when it comes to access, and then you want to look at areas where World Vision work across the 31 districts where we are operational, in all the 10 administrative regions, you have, in terms of facilities, the closeness of health facilities to mothers and children or families being a challenge. The distance that it takes them to get to those facilities is a problem. We need, workforce in terms of the numbers of, health professionals that have to be there to give, the needed, attention to people out there, and not only to talk about the rural community, but Ghana in general.
Okay.
But I think there's a concentration of when it comes to access to facilities and other care, more concentrated in the big cities, so to say, as compared to when we come to rural areas. So there are a lot of more of such things we have to be working on.
So let's talk about those specific health issues that affect children usually under 5.
With issues that affect children under 5, you and I know that the most common illnesses we have in Ghana and the most reported cases are malaria, and we have treatments for malaria. But when you go deep down into the grassroots, you realize that children still die as a result of malaria, children still die as a result of pneumonia, diarrhea, and even malnutrition. All
right, and I'll plead with you, Micah, to just hold your thoughts there. We're launching Clean Communities today at Kakalamaду, and quickly we want to just join in the launch briefly, and then we'll be back. Sorry, we'll be back here.
We'll continue with the morning's proceedings. So let me invite Madame Dorothy Tego to give us the opening prayer.
Our Heavenly Father, we want to thank you this morning. Daddy, we give you the glory, we give you the honor, we give you the praise. We thank you for your message. We thank you for your guidance. We thank you for your protection. Father, it is by your will that we've gathered here. Father, we are here, oh God, to launch this program. And we commit and we pray that we invite you, oh God, to be among us. We also...
Okay, so now that you have a feel of what is happening at Kakalamadu, we will let you in on the action a bit later on. This is still my banner on the AM show, and we're talking health issues that affect children under 5. And Michael was sharing a few things with that. I think you talked about malaria.
Yeah, I mentioned malaria as one of the major causes that affect children under 5. We also have diarrhea, we have pneumonia, just to mention a few. This happens as a result of probably the stock out of essential medicines in health facilities we have across the country. For example, you can visit a health facility far in a remote area, and you would realize that they might not have enough essential medicines that are responsible in treating some of these illnesses I have mentioned. Also, we have parents reporting cases late, and so we are just trying to raise people's awareness to see how some of these causes are alarming, and also for them to know that these causes are easily prevented or treated.
Okay.
Yeah. Now, if I can add.
Sure.
Yeah, if just to add to what Micah has said, it also boils down to management of even such situations when they do occur. For example, what about the mother who gets a child who is ill? What does she do? How quick is that mother, able to access, service, by being, let me say, responsible herself? Sometimes it's just about the fact that they are not aware as to what they need to do in such circumstances, and therefore what we do largely for World Vision, which is a community-based organization, is to really work more on community mobilization. That's engaging these mothers, creating more awareness by working with Ghana Health Service, and letting mothers know that when you even have a situation like this, the first thing you have to do is to begin to talk to someone who helps you to get care for that child.
Okay.
And so that is one thing that I said. We think that in terms of making sure that these children are not dying, the mothers and the families, all of us, are responsible, to be able to support and such that we bring these levels down.
Okay. Yeah. So let me just ask you to share with us what parents who cannot have access readily to health facilities do. I mean, how can they ensure that their children who are under 5 do not get infected or affected by any disease whatsoever?
Okay.
So if you like precautionary measures, what do you do to prevent your child from getting a disease?
The best way to prevent children from getting infected or from getting diseases is practicing good environmental hygiene, and then also ensuring that you keep your surrounding and everywhere clean around you. When you do that, you reduce your rate at even getting some of these illnesses. Taking, for example, malaria, we know the major preventive measures we can employ to reduce the number of incidents when we talk about malaria. And so some of these things are measures you can put to reduce the rate at which it happens. But to also talk about the fact that even places where accessibility is limited, we have home-based trained volunteers that are working on the ground that you can seek early treatment from before they even refer you to the nearest facility. But right now what we are bringing forth is about accessibility to quality health care. And so we are calling on the government, we are calling on our duty bearers to establish more clinics, to establish the CHIPS compound that we have studied to know that it is one of the most cost-effective ways of health delivery in the country, so that when health delivery is at the doorpost of the community, we would be able to reduce infant and maternal deaths, and also contribute significantly in reducing or contributing significantly to the Millennium Development Goals.
Okay. Yeah. So Raymond, since you're a nutritionist, I want you to share with us practically what sort of foods children under 5 can take and be safe.
Thank you. One key recommendation that we always give is that that child should be exclusively breastfed, for 6 months. And
so 6 months is cool.
Yeah, to show. Then from 6 months to 24 months, we want it to be extended. So you don't feed up to only 6 months, but you have to continue.
But if the child,
we appreciate
if the child, because some children would naturally on their own refuse the breast milk.
Yeah. Yes. So that is where mother's care comes in. Yeah. What happens is that as you exclusively breastfeed your child, there is something we call bonding. The child, wants to get closer to you all the time. The child, that bonding comes about, and so it enhances, even what you do as far as feeding this child is concerned.
Okay.
If you are not that close to that child, as the gap comes and the child, you are not that always there for this to happen, of course you are creating a kind of a gap.
Okay, but I know that there are some people who would love to breastfeed their children, but they simply do not get the milk, even from the very beginning.
Yeah, I know there are some difficulties like that, but one advice that we always give is that, once you breastfeed continuously, you try, even with that, you continue to breastfeed. What happens is that the body itself, reacts. We have hormones that
So
do
even
that.
if nothing is coming, just continue doing it?
When that happens, then there is support that is given. There are other alternative, assistance you can get. But what largely we want to encourage is that those things happen. But when a mother really, becomes interested in continuing to try and to express the breast milk and feed appropriately, because we have even ways of feeding. Sometimes the positioning of the child, the way it has to be done, is not properly done, and therefore it doesn't enhance, the feeding.
Okay.
And so once the mother does it properly, and then it's continuous, the milk flows, and to 24 months, the mother is still there for this child. And then, at 6 months, we all appreciate that the milk will not be that adequate for that child anymore longer, and therefore we advise now that you start introducing complementary foods.
Okay.
And it has to also be gradual, because the child, with that small stomach cannot take, a lot of food. So at 6 months, you are giving that child breast milk, but then you are adding like 2 meals a day. And then from 7 months to 8 months, you are looking at giving that child 3 meals, but then with a snack, one snack. That's 2 meals with 1 snack.
Okay.
And then from 9 months to 11 months, you are increasing. So
what do you call a snack?
Oh, you can give banana to that child. Kosi is good for that child. And then this should go with age, right? And then fruits, and so in between, and then the child should be fine. And then you breastfeed, and the breastfeeding just continue to give as much as possible.
Okay. Yeah. So typically, what should they be eating? A lot of grains?
Yes, that is what we always want to talk about. When it comes to the way we normally eat in Ghana, of course you find we normally want to refer to 3 food groups, for simplicity. That we have those that are, like we call them the bodybuilding foods. We have those that we call that they give us energy, and they are the ones that are protective. Okay, so in the category of protective foods, that's where you have vegetables and you want fruits largely. That we always want to encourage that they should go with all these other ones.
Okay.
Other than that, mainly our diets are more of the energy giving ones, which are the carbohydrates, the oils and stuff, So these ones, when we call them protective, that means that they have something to do in fighting off, illnesses, right?
All right.
So that is what, as a child,
all right. So let's get into World Vision's Global Action Week celebration. What is it about?
Yeah, World Vision Global Week of Action actually is a popular mobilization period that we have chosen to happen in the month of May, beginning yesterday through to the 8th of May. Actually, it is part of the Child Health Now campaign that World Vision Ghana officially launched in January. And as we speak, currently over 45 countries around the world in World Vision partnership is celebrating this Global Week of Action. All we seek is to just create awareness of the public on what is happening around issues of maternal, newborn and child health. We also want to collectively involve everyone. The media is a very big stake when it comes to this, because we want our voices to be heard louder, to a very wide coverage as well. And so we are telling people that we all have a role to play in ending preventable deaths. And so we are commemorating this period not only here in Accra, but across Ghana. We started it by having the World Malaria Day that we commemorated in the Saboba district of the northern part of Ghana. And over there, we even had a drug donation that cost over 35,000 Ghana cedis. And this is what we have been doing continuously. And as a matter of fact, with Child Health Now campaign, the partnership has committed over $1.5 billion in contributing to the Millennium Development Goals we have, which is ending just 2015.
Okay, all right. So we'll talk more about it, but we'll have to go quickly back to Kaklamadu. All right, so if you're enjoying it, just raise your hand. It means you're supporting the call for children to survive beyond 5 years and more. So we're discussing challenges we face in our communities. That's what the event at Klamadu is all about. And also it's in that same spirit that we're also in here talking about the issues that affect children under the age of 5, because a lot of children, we're told, do not survive, go beyond 5 years of age. And that's why we want our communities cleaned so that children can survive in our own communities. Remember, the multimedia group is also celebrating 19 years of excellence. And we're doing Clean Communities as a test case of Klamadu, a community in the La Dade Kotopon municipality. We're using Klamadu to spearhead an intensive media campaign to create a national impetus for clean communities for a healthy nation, holding leaders accountable for poor sanitation policies and empower citizens to create sustainable community-led sanitation solutions. So we will go back to Klamadu, but for now I do have my friends from World Vision, and you're watching what we're doing at Klamadu. It's similar to what you're doing.
Amazing. Yeah, that's great, and we can only commend you for this example, and that's the partnership, and we are glad to be part of this particular exercise that is currently going on, and to have us working together is what we have been talking about. That it doesn't take the government alone, it takes all of us. That when we do those contributions in those little amounts, so whatsoever, it can be cash, can be in kind and all of that. Encouragement even, makes a big difference. And that is why
I must say a big thank you to Star Ghana, because it's with their sponsorship that we're able to do this.
That's amazing. And then it's that we also then want to say we want to encourage other entities like them to be part of
entities
this,
such as yours, because we say that, see,
including us.
We're told, media, do this, but we can't just wake up and do it.
Sure, we agree with you.
We need support from World Vision, for instance.
So like I was saying, offset with Child Health Now campaign, we also seek to address most of these issues that were being highlighted at the Clean Communities campaign that has been launched or is still underway being launched. And so one of our approaches that we are using under the Child Health Now campaign is to empower our citizens, especially at the grassroots level. We want to sensitize them, we want to empower them on current health policies such that they can be able to engage with our duty bearers, they can be able to engage with policymakers, to be able to demand for improved healthcare services at that level. And also even at the national level, we want to join hands with the media, I have mentioned already, want to join hands with also coalitions of civil societies that are into health, so that we can engage with our policymakers to see how we can implement policies that we have drawn, but the implementation level has some level of gaps. So basically that is what Child Health Now campaign of World Vision Ghana is seeking to address, so that by 2015 we would be able to say that we have been able to measure quite a good amount of success in reaching the Millennium Development Goals.
Okay.
And possibly just to add, why this is so important is that our goal, if we want to look at bringing down child mortality, the intention is that by 2015 we should have 40 deaths per 1,000 live births. Currently, as he earlier mentioned, we are not there yet. We are still up. It will take a lot of work for all of us to do, bring this down. And that is why a partnership like this with the private sector, the media, and all of us, the government, and everybody else has to be on board within this very period. And we see how far we can go, and then even beyond 2015, to be able to say that every child must survive 5 and beyond.
Okay.
Yeah.
All right. And when you watch that brief video that we bought, you realize that the European children or some of the American kids are looking healthy and excited, but when you come down to India and Africa, you see the children very poor. What is that supposed to tell us?
Actually, about this video, we are just highlighting on issues that children go through when it comes to infancy through to the age of 5. And in this video, you would see some children having the best of life when it comes to health. They celebrate their birthdays, they join church singing groups as kids, and what have you. But when you come to developing countries, during that period, it is set to be a matter of life and death for this child, because probably we do not have our systems working enough for children to have adequate health care such that they can be able to do same as in the developed country we see children doing. So they also have their health gaps, but I want to state that health gaps in the developing or underdeveloped countries are larger and wider. So we are calling on world leaders to be able to implement the good health policies they have set for various countries, especially also Ghana, to implement it fully so that we can bridge that gap and also have our children below the age of 5 to enjoy life in all its fullness.
Okay, so let me just say that even here in Ghana, there is some good news somewhere, and it's in the Kumbungu districts where we're told that there's been some reduction in child mortality. In the story, and I'm pulling this from myjoyonline.com, date is 1st March 2014. It says big gains have been made in child healthcare in the Pilo community in the Kumbungu districts in the northern region following the introduction of the integrated community case management program. So I guess it's still community. We're urging, this is about us. And I guess by now we've all realized that the politicians can do very little. They talk plenty, but do very little. When it comes to our health and environment, it's up to us to do something and change it and make it look good. Can I say thank you to you?
Yeah.
But you want to say something finally?
Yeah, before that, because of what you just said about this particular evidence of some success, it is very important to acknowledge, that cadre of volunteers, at that community level who do a lot of work, who actually step in to bridge the gap between, in terms of care between, the mother with that child and then the next level of care, which is like the health facilities, the CHIPS company and stuff. When capacity is given to those people and giving enough encouragement and resources that at their level they could really use, they are doing a lot of great things. What we are talking about here is that you have these volunteers trained in how to manage malaria, at that level, ensuring that mothers have appropriate information and they want to seek care timely, so that when there are complications, they are the ones who do the referrals.
Okay.
This team we need to do a lot more around them. As I work in this field, the issue has been around motivation of this cadre of volunteers. But as we speak, we don't have clear-cut definitions as to what it means to motivate these ones. So we do it in various ways, to keep people, doing this kind of work. But how long sometimes could they continue, to be volunteers? People have ambitions, and therefore that's why I think that all of us, whichever form that we could be there, government cannot do it all as we are acknowledged, to be able to give some kind of encouragement of support in diverse ways, opinion leaders, whoever chiefs and community members, encouraging these people. They could be 3, 4 in that community who do all of this, and sometimes they leave their farms and just be there for these children that they must survive. These people are very critical when it comes to our healthcare delivery system, and therefore I just wish that we all, want to work with them as well and do what we can to bridge this gap until that day when we have a facility so close to every family, in Ghana.
We'll get there. I have a lot of hope.
And for me, as just winding up, I want to say that not only are we partnering with civil societies, the faith-based organization is also a very key influential body when it comes to the reduction of maternal and child deaths. And so as part of our Global Week of Action, we are partnering with the Christian Council of Ghana to be able to send sensitization